Debbie?
Yes.
Introduce just your name and the diaper bank you're from.
Debbie Key, Midland Community Diaper Bank.
Great.
And hello, this is Rhonda Hahnemann. I'm with the United Way Fox Cities Diaper Bank.
Okay.
Hi,
Don?
Maria. Oh.
Can you hear me?
Yes.
This is Dawn Durham from Newborns in Need Union County Diaper Bank in New Jersey.
Okay, great. Amelie?
Hi, it's Ellen Simon from Mr. Circle Foundation.
Okay.
And I'm calling also for Fran, who won't be able to join us today.
Okay, great. Greg?
Yeah, I'm here with Tucson, Greg Poisel, Tucson, and we are the Diaper Bank of Southern Arizona.
Super. Jennifer?
Same, Diaper Bank of Southern Arizona, sorry.
No problem. Marge?
I'm Marge Boyd, and our diaper bank is called Baby Care, and we're north of Milwaukee, Wisconsin, in Sheboygan.
Maria Lourdes?
Maria Lourdes Reyes and Emily Edquist from Project Concern International.
Okay, great. Martha?
Martha Beamer, Catholic Charities, Pittsburgh, Pennsylvania.
Super. Mary Pat? Mary Pat, could you just repeat yourself again? Okay, Mary?
Mary Pulfra from the Twin Cities Diaper Bank, Diaper Drive.
Okay. Nerea?
I just saw Mary.
Hi,
Look
I'm
at that.
Nerea.
She's using video.
Calling from Sacramento Food Bank and Family Services in Sacramento, California.
Okay. Pat? Pat? We'll come back to Pat. Yep. Whitney?
Hi, this is Whitney Hunt and Sarah Schills from Westside Baby in Seattle.
Okay, great. And William Wildhack.
Yes, William Wildhack, Baby Basics of Sarasota.
Yeah, this is Roy Liberator. They were supposed to come here today to do my maintenance. I'm just wondering what's the story.
Well, we'll just take care of that and put that person on hold. All right, so if everyone who's at the moment can put themselves on hold, unmute rather. Yeah. And anyone who hasn't introduced themselves who would like to introduce yourself, your name and your diaper bank.
Okay.
One at a time, please.
Samuel Jones, Tri-Cities Diaper Ministry, Bristol, Virginia.
Okay, great.
Madeline Fish, Eastside Baby Corner.
Okay, great, thanks.
Kelsey Weeks, Catholic Charities Diaper Depot.
Welcome, Kelsey.
This is Valerie Glass from the Piedmont Diaper Bank.
Valerie?
This is Jackie Cashew from Baby to Baby.
Hi, Jackie.
Michelle Lee, Mount Moriah Ministries.
All right.
For Boren with Infant Crisis Services.
All right, great.
Nikki Lule, Northport
Northern New Jersey.
Okay. And anyone else?
Janet Alfano and Kim Hunter from the Diaper Bank in North Haven, Connecticut.
Great, great. So what I'd like to do is throw out
Pat Kennedy is waiting.
Oh, Pat. Pat, you have a question. Pat? Okay. What I'd like to try first I threw out for people to consider is, how do you calculate the value of the diapers? And we have sort of a couple of different subsets of that. Do you value them differently depending on whether you purchased them or you donated them? And do you value them differently by size? And just because Janet sent her answers in earlier, I would like to have her kick off the discussion on what she does, why.
Oh, okay. We actually used to do it differently than we do now, and we've evolved to how we're doing it now, which is to value the diapers as to our last price that we purchased them for, which may be different for other folks because I don't know how much folks are actually purchasing diapers in bulk, but we do our last purchase is our valuation of the diapers based on size. It's different for each size.
So do you change the value as you for all the diapers in your inventory once you purchase new diapers?
So right, basically we use QuickBooks for inventory, and what will happen is the value of our distribution after our last purchase, if the diapers price in fact has changed, the valuation of those diapers will change to reflect that.
Why?
Can you answer why?
Yep. Well, we used to have just one standard price that we valued the diapers at, but this really more accurately reflected fluctuations in our own cost, and so we felt like we should value our diapers appropriately according to what we are actually purchasing them for, because the overwhelming majority of our diapers are purchased, about 80%.
Why not just carry them at the purchase price?
Well, that's exactly what we're doing. We're carrying them at the purchase price.
Not if you're reevaluating each time.
Because if our purchase price might change. So
I guess the question is how long? I mean, how long do you have an inventory in stock before? Before you how much of your inventory do you wind up having in stock that you have to revalue doing it that way?
I mean, not a lot. We don't carry a lot over. You know what I mean? So we have a decent idea of what we'll go through during any given time. But this year it has actually changed because of some of the donations from the National Diaper Bank Network, which we're so grateful for. But prior to that, we were purchasing diapers about every other month or every 1.5 months. So they were in and out.
Okay, great. Kia, you have a question?
Yes, I'm sorry. I had to take it off mute. Okay, for someone like for our diaper bank where I never ever have to purchase diapers, how do you put a volume on them? You just, yeah, that's what I need to figure out.
Okay, does anybody have any thoughts? Suggesting Kia. Maria, I'm sorry.
It's okay. It's Maria. What we do is we are currently using Salvation Army's National Evaluation Guide and take the overall average.
Tell me that again. The guide.
Salvation Army's National Valuation Guide.
Thank you.
This is Joanne. That's a great
Yeah.
that's a great thing to use, and I'm glad you brought it up. We can send it to everybody who's on the call when we send out the notes. We can send that document as well. Thanks.
Thank you.
Anyone else have a way of with donated diapers?
Hi, this is Madeline at Eastside Baby Corner.
Hi, Madeline.
Hi. We use an average cost based on our purchase price, but we do not change that on a monthly basis. We use the same number throughout the year, but we do use a different number for diapers that are donated to us. We use a slightly higher cost because we can purchase diapers at a more attractive rate than people that are doing a drive on our behalf.
Okay, so you're using more like the market rate. They might be more likely to buy it as opposed to bulk rate.
Yes. With that, I guess that speaks to the question about we do value them differently depending on if they are purchased or if they are donated.
Okay. Any other thoughts? Sorry, Whitney.
Hi, this is Sarah. We do the same thing that Madeline just described at Westside Baby, but we do an average cost. It's about 25 cents a day for everything, so donated and purchased.
Okay.
And what numbers do you use?
This is Madeline again.
And to come up with the average?
Yeah.
It's run the gamut. Generally, we use a purchase price.
Okay.
Okay.
Yeah.
Madeline, you're about to say something?
Oh, no, I was just going to say that's what we do, too. It's based on our purchase.
Okay. Mary, you have a question.
Yeah, about the donated diapers, could somebody elaborate a little bit more on that since all of our diapers are being donated at this time? What rate that is that they use?
Well, one suggestion was the Salvation Army National Valuation Guide rate, which we're going to send out to everyone. Others have suggested that they use what the market rate is for buying diapers.
Anyone who buys them, give how they get that number? Or anybody who values their donated diapers, give an example of how they get the number they use if they don't purchase? All right, okay. I will give an example. This is Joanne. The way that I did it before Janet came up with this real way of doing it, I would go to the supermarket or to, a drugstore and look at the different diaper costs there and then average them. I didn't use the lowest numbers and I didn't use the highest numbers. Every community has sort of a, there's a price point. And I would just look at that, do a spreadsheet with those numbers and come up with a number. And it often came to around 25 or 26 cents, because you're looking, I would do one number instead of different numbers for each sizes. It is, of course, more accurate if you do every size because the diapers are such different costs. But you can use an average through, looking at your local, how much it costs to buy diapers in your community.
By a show of hands, how many people value the different sizes differently?
We do. Show of hands.
Your hands.
We do not.
How do we show our hands?
Catholic Charities
We do it. The Piedmont Diaper Bank has two different groups. And so we'll do kind of like the newborns through size 2 as one size, and then the 3, 4s, and 5s and pull-ups as a different rate.
Yeah. All right, great. So any other questions about the valuation of diapers size or donation? All right, so what about this question? How do you account for, or do you account for, items you receive as a donation that aren't diapers?
This is Madeline at Eastside Baby Corner, and I think you know that Eastside Baby Corner and Westside Baby Corner diapers is just one of the items we distribute. So yes, we keep track of all the other things that we receive, but we leave it up to the donor to fill out the valuation form. They take the form when they drop something off.
Okay, great.
I have a question.
Sure.
How do you classify a donation that comes in like from a corporate sponsor? Like they had an old tent which they donated to us for events and stuff, but we got to value it for inventory.
Right, so I think that's the question that we're asking people. Can anybody, so there are people out there like Eastside and Westside Baby Corner, and I know Baby to Baby and things like that take organizations that actively solicit and distribute other things. But for organizations that are just diaper banks, only do diaper banks, can anybody speak to how you value or account for or think about things that are not diapers? Is there anybody who can talk about that a little?
Hi, this is Janet, excuse me, from the Diaper Bank in North Haven. We don't have really a great system for doing that, and so we try to kind of get them in and out as soon as possible. We send an acknowledgement, but they've never hit our actual accounting software or our books. So we have a list, like a little list in Excel, but we're not necessarily accounting for them. I hope someone else has a better system than that they can share.
Well, we do have some other people raising their hand. I just want to say that part of the reason Madeline mentioned that people value their own, when you're dealing with in-kind goods, the donor has to make the value. You know, it's not up to the person receiving to value it just from a tax standpoint. Martha Beamer had her hand up.
I was just going to say the same thing. We oftentimes get clothing and different things above and beyond diapers. And the donor, even if it's a corporate donor or an individual, we have a document that we have them complete, and we make them, on that document, list the items donated and what the fair value would be. We don't assess that fair market value.
That's really interesting.
Okay. And Maria Lourdes, you wanted to add to that?
Yes, actually, the accounting principles used for in-kind donations. So you could either Google that or, you know, really take a look at that. And then what you need to do is then look at the value, fair market value of that. It is not donor-driven. So if the donor says, I'm giving you $1,000, you still need to go and look for the fair market value. Like I said, it's called GAAP in kind, GAAP in kind, and it's really in kind contributions received by nonprofits. So in order for you to book that as an in kind donation, you really should follow the GAAP in kind coding system. In addition, you could also code the donated by the volunteers to your organization or the diaper bank.
Yeah, that's an excellent point.
I guess that what I meant, Maria, and I want to clarify this, I'm sorry, was that organization gives it a value, and you're right, by using the GAAP standards. But when you write a thank you note to somebody, if they've given you a thing, you don't value it. They value it themselves. So it's two different valuations. Does that make sense?
Okay. Any other thoughts? William Wildhack.
Yes.
You wanted to add to the conversation?
Well, only that. Not really. When we receive donations, they are usually very modest, and we get rid of them very quickly because we're in the diaper business, not in the anything else business. And so we tend to not be as careful as perhaps some people who are deal with this more often.
So more along the lines of the system that Janet described. You make note of it, but you don't really hold it into your inventory so much.
That's right. We
Actually,
never list them in inventory.
Right.
We had an accountant tell us once that you could only book things that you would otherwise pay for. So that, like, if you would buy diapers, or say you get free rent, that gets booked, but that if you get a tent that you would not have bought, that you don't need to book that. But, you know, it's something that really is an accounting.
Yeah.
All right, so,
Maria.
Oh, sorry, Maria.
Maria, no problem. So I just really quickly wanted to add, in our program, in addition to distributing the diapers, we do all baby supplies, so it's clothing, formula, and baby food. And some of the sources for the donations are just bulk, large, and we're not getting receipts for that. We just do a big thank you to the supplier. And so what we've used in the past specifically for the clothing is Goodwill has a guideline that they use, and I can't recall the name of it at this time, but we use a guideline from Goodwill for a lot of the clothing because it's going to be mostly used clothing that we receive, and that's what Goodwill deals in. And then just for any other miscellaneous, just kind of trying to find an average median cost from like a Walmart or an Amazon.
That's a great idea, and I think we can pull up the Goodwill. The Goodwill thing is online, isn't it? I think I know what you're talking about, but I can't remember the name of it either.
Okay, that's all I wanted to add.
Great, thank you. Tia, did you want to add something as well? All right, so let's go on to the next topic. Do you have for those of you dealing with agencies, do you have a minimum that the agency must order every month to be part of the distribution system?
This is Kelsey from Catholic Charities. No, we don't have a minimum that they must order. It's pretty average. I mean, they pretty much order on average the same amount monthly, but it's not mandatory. If they order 1 pack of diapers, it doesn't matter if they order 1 pack or 25 packs.
Okay. Does anybody have a minimum?
Whitney.
Oh, Whitney, I'm sorry, I didn't see you. I scrolled too high up.
Hi, I'm sorry. No, we don't do a minimum per agency. We're a little different. We do it per child, but again, it's the opposite. It's a maximum, not a minimum. So.
Okay. Wildhack?
Jackie from Baby to Baby.
Jackie.
Hi, sorry, I'm not online, so I apologize if I'm cutting in someone else's turn. We have about 50 different agencies, and we just don't have enough diapers to meet the huge demand. So we look at the size of the agency and how many children they're serving, and then we sort of break them into small, medium, and large groups and divvy up the diapers that we get per quarter based on size of the agency.
Okay. So what you do, rather than having the agencies order, you give out what you have available each quarter then?
Yeah, we have a set number that we assign to them because we simply can't meet the needs that there is among the 50 different partners.
Okay. But you want to add something?
Yeah. We have here in Tucson, we have our agencies have to have a minimum number of clients that they work with for us to continue working with them.
Okay. And Teresa, you have a question, an answer? Teresa, Baby Basics?
Oh, I hit that by mistake, sorry.
Okay, no problem. Okay. Maria?
Yes. Samuel Jones, Trustees Diaper Ministry. Here in Bristol and the other 3 cities, I mean, we're just so new, but we also have some of these agencies that get them on like a crisis basis, like DCS and stuff like that. They get a child in diapers. There's a homeless program we have in town that gets diapers if they have children in diapers. There's not enough frequency out of these agencies that they're just on, and those are an as needed. Then we have our regulars that get them monthly.
Okay, great. How about maximums? Does everybody have a maximum? And how do you determine the maximum? Whitney.
Hi. So we have a hybrid approach here. We have a maximum we determine for our larger agencies how much they can have on either a weekly or monthly basis, and then for the smaller agencies, per child, it's 45 diapers a month.
Mr. Wildhack.
Yes. No comment.
Okay. Sorry, you saw your hand up. Anyone else? Greg.
Ours is a rolling 12-month maximum.
Greg, I'm sorry?
Ours is a rolling 12 months. So we keep track of everything on a month by month annually, and track it that way.
Okay. Maria Lourdes.
Yes, I didn't hear the last statement. What was said?
I'm sorry, could you repeat your question?
Oh, hello, can you hear me?
I can, yes, thank you.
Okay, I didn't hear the last speaker, what was said. Okay.
Great, could you repeat what you just said about the rolling system?
Yeah, we keep track of what every agency requests, and we give them every month, and it's a rolling maximum. It's on a 12-month basis.
So how does that work, Greg, as a rolling maximum for a 12-month basis? That means that if you have sort of a annual cap that if people are allowed to vary that with month.
Well, they're not allowed to exceed an average 1 month allotment, but
okay.
We base that average off of a rolling 12-month tracking.
Okay.
Yeah.
Maria Lourdes, did you want to add?
that from our other partner organizations. They usually give out their diapers on an emergency basis only because we don't want the participants to be totally reliant on the diaper bank or the organization. So, for example, Black Infant Health, we partner to help give them some of the diapers. We only give 8 diapers to a participant, and that's on an emergency basis. We're still figuring out what is the capacity. So for us, we provide diapers to the organization. So we might give them 3 boxes, and then they in turn give out on an emergency basis per diaper. 8 diapers. So you think it should be asked for Aaron?
Elika, you wanted to add something?
Yes, I'm actually having a really hard time hearing the person presently talking right now. I'm not sure if she keeps cutting out or what's going. I'm having a real hard time hearing her.
I have to admit, I'm having a tough time too. Maria Lourdes, could you repeat what you were saying about the emergency supplies? Because it did sound like you were cutting in and out.
So I'm actually close to the speaker. So is this okay? Should I call in?
Calling in might be better.
Okay, so let me look at the meeting info. I'll call back in. Please continue.
Okay, thanks. Thank you very much. How many people one question that sort of comes up, we have the questions of maximums for agencies and what about maximums for babies? What do people give out per child per month?
This is Valerie from the Piedmont Diaper Bank. We give out, depending on how the agency needs to use the diapers, some agencies will kind of give out like a handful of diapers at a time, but some of the other agencies, like food pantries and other organizations that are working, where people can kind of come in and are looking for more financial help, we give them what we try to make a week's worth of diapers. And we do that based on our own experience as moms, and we notice the standard size package, like that 50 diapers for size 1, 42 diapers for size 2s, 36 for size 3s. Like if you just get a standard package at the grocery store, that's how they're numbered. But that generally is about a week's worth of diapers. So we've kind of stuck with those numbers, and we kind of, depending on what we have, it's kind of plus or minus a few. But that's kind of what we've packaged for a week's worth of diapers based on the size of the diaper, because as they get older, they use less, but the newborns use a lot more. But then other agencies do just kind of give out maybe 10 at a time.
Okay, so you don't repackage the diapers then?
Sometimes we do. When we buy them in bulk, we will repackage them, and that's what we use a lot of volunteers to do for us, to repackage. But now that we've been starting to buy from Cuties a little bit, they come packaged like that, and so we can give them out that way. And so it just kind of depends on where we're getting them from, and some, we also accept open packages, so we'll take some of those open ones and repackage them into other bags to take that number.
Marge?
Yeah, we give 2 boxes. It seems to be more than other people are giving, but we do give 2 boxes each month to each recipient. And that actually probably only meets their needs for half the month, but we feel like that's a generous supply. We do repackage the diapers that are given in bulk into packages of 20s, and then we would consider 40 would be 1 package. We would actually give them 2 packages. 2 packages each month.
Okay. Angelica?
We do a similar distribution as far as giving it out a week, and we repackage everything we get in. So we try to give, 12 diapers for infants per day, so that's about 96 per week, and 8 or so a day for toddlers. So, and we just basically figure out 5 toddlers average, so probably 3 to 5 or 4 to 6, those diaper ranges. And so that's kind of what we're doing, but we do repackage everything. Is that a common practice, or are people actually just sending out prepackaged diapers.
That's a great question. What do people do? Mr. Wildhack.
Yes. We distribute twice a month, and we have a set group of recipients. We give a large box basically each month, and we give half and half if we can, each distribution period. So they end up getting a 250, well, depending on size, right. A full, whatever you call it, box, case, whatever, is what we distribute, because the manufacturer clearly knows what, that's their estimate of what a month's worth is, we think. We never
My apologies. I missed seeing your hand earlier.
Okay. We never break a package in a box. Okay. We keep them in the paper package. Lots of reasons we do that, but just works well for us.
Okay, great. Whitney?
Yes, we repackage every single diaper that comes through our doors, unless it's one of our two biggest agencies. Those we distribute in bulk. But every other diaper we package into packages of 45 diapers. So we use volunteers to repack those. And 20 of pull-up.
Okay. Mary.
Hi. We take over the UPS symbol. We write the diaper drive on there, or we cut it out. We do not repackage unless we have open packages and we combine different diapers into one package. My question is, the ones that are repacking everything, what are they using, and are they getting a good cost for what they are repackaging their product in?
I want to do this and then
Great. Well, we'll come to that in just a second. Want to first check in with Baby Basics and see what they do. Teresa?
Yeah, we actually don't repackage, and we supply 2 week, or we distribute every 2 weeks, so a 2 week supply diaper families. And it averages out, just depending on size, between 5 to 9 diapers a day, whether it's a size 1 or 2 or 6. We just give our volunteers the minimum quantity that should be in that package, and it just it floats around there. But we try not to open the packages up either. We try to just give it a little bit more, then we just give it to them without opening the package up.
Pat? Pat Kennedy? Mute button on, Pat? We can't hear you. I'm sorry. We'll go on to Maria Lourdes.
Okay, I just unmuted. Can you hear me?
Yes.
Better. Okay, this is on the phone. So what I was saying was we distribute to partner organizations, and they in turn distribute on an emergency basis to their clients. So the emergency is between 8 to 10 diapers. They don't go beyond that because what they're encouraging is self-sufficiency. So we don't want the diaper bank to be the ultimate end-all for the source of diapers, because there's just so much need in the community. So, and we're new, so we're still working out and learning from all of you as far as how best to do this. That's all.
Okay, great. Maria. Maria?
Oh, sorry about that. I pushed the wrong button. I just kind of wanted to add, as far as what Maria was saying, is that we run our program a little bit differently. What we do is kind of partner it with our parent education component, and so what we do is based on their family's participation, they're able to purchase the diapers using baby books.
Okay.
So what we do is we offer both. We keep them packaged, but we also offer for individuals that maybe just have an emergency or can't participate or don't participate as much as others, then we do individual packs of 10.
Great.
Okay.
Well, let's go to the question that Mary raised. Packaging diapers. How do you do it? And what do you pack them in? Do you pack them in old supermarket bags? Do you pack them in Ziplocs? Do you re-wrap them? First, what do you have to say?
Re-wrap. Just re-bag. Re-wrap, yeah.
Re-wrap? I couldn't hear.
This is Kelsey from Catholic Charities. We do just reuse bags from grocery stores and things like that, with boxes and stuff. We keep the boxes from the bulk that the diaper donations that we get, and we use those boxes to help distribute and give them out to our clients.
Popped up. Let's see. Kathy.
Yes, hi. This is webinar. Web events made easy. Welcome to the webinar. You have entered as an attendee in listen only. Make sure that you get very specific information. For example.
Hey, Kathy.
Hi, this is Kathy from Cradles to Crayons. We have a little different method with for those of you unfamiliar with our organization, we collect new and gently used children's items, and then we give out kid packs, individualized packages of items that are for children 0 to 8 to 12. For the diaper piece, try when possible to add the diapers into the kid packs that are going out the door. So a social service agency, one of 300, places an order with a particular child. If it's an infant or a child that is using diapers, they will ask us to add that in, so that the package is a clear plastic bag that includes clothing, footwear, toy, books, and diapers. We also do the bulk distribution, which is what we did the most recent donation, where we call our partners, and our partners then will make it schedule an appointment within a certain day, and they'll be entitled to receive a ratioed amount of bulk diapers for the families that they serve.
That I did go. So do not let anyone walk out that door. Outside that idea. Because what will happen that nobody takes responsibility.
Whitney. Valerie, what do you guys do for repackaging?
We've been using grocery bags, and we've also sometimes the grocery bags don't quite fit as many in, but I found that the ones you buy at like Costco that just kind of say like thank you on them. We have like you can get like 1,000 of them for like $14 or something, and we use those as well.
Rhea?
Oh.
Marge, did you want to add something?
Yes, I do. We found a good thing at the hardware store, which is a roller with like a huge thing of saran wrap. And so take the bulk diapers, we wrap them around both directions, we try to pack the 10, but we now do packs of 20 work perfectly. And you can get them, you can really squash them down to make a really small package of 20 with this saran wrap. And the roll has lasted us a long, long time. So it's an economical way to package them, and it's also good for storage because they're flat.
Right.
Do you think, Marge, you could send Allison the information about that so we could send that out to everybody? That's something that I don't think a lot of people have heard about.
Sure.
Thank you.
I will do that. Thank you.
Whitney, what do you suggest?
We reuse grocery bags, but we also use the Costco can liners. But more often than not, we are reusing the packaging that the diapers come in. So if it's a plastic sleeve of 47 diapers, we'll take out the 2 and then we'll just seal up the package. So we're kind of doing all of the above.
Okay, great. Janet, what do you guys do? I know that you're all excited about your new method.
Thanks. Sorry, I had to pull over. We're on the road. So,
such dedication.
I'm glad you pulled over.
Thank you. We just started. Actually, we were inspired by Westside Baby, so thank you to start repackaging. And we just started doing it, and we use U-line bags. The picture. The 1, 2, 3. Yeah.
And where do you get U-line bags?
It's actually uline.com. I actually sent Allison, I sent you the links to the stuff that we found. It's actually not that expensive, and we bought a sealer as well.
Okay, great. So we'll send that out along with all the other information we're collecting. All right, terrific. Greg.
You know what? Yeah, because I think it's putting it as a picture.
Greg?
Yes. You should do it right, but sometimes
Oh, hi, Greg. We can't quite hear you. Could you speak up a bit?
How's that?
Much
so
better.
Much
Thank
better.
you.
All right. We try to use the original packaging as much as possible, and when we have loose diapers donated, we use the U-line bags as well.
This is 103.
Great.
Thank you.
And Mary, you wanted to add something.
Yeah, I wanted to know, do you guys then, when you repackages, are you guys using a label, or do you write on your bags the size and the quantity? Or are they using a label?
We write on
Anyone
our
who's repackaging want to add to that?
This is
Whitney?
Kelsey from Catholic Charities. We write on our bags.
Okay, great.
This is
Whitney?
Janet. We just put a label. Oh, sorry.
Okay, Janet, does the label?
Yeah.
Whitney and then Rhonda.
I'm not sure who's speaking, but we're having trouble hearing you. Rhonda and then Valerie. So Rhonda first.
Hi, this is Rhonda with the Fox City Diaper Bank in Appleton, Wisconsin. We actually use the U-line bags as well, and we have purchased the labels that have our logo on one side, and then we have our volunteers write the size of the diaper, and we use that to seal the bag.
That's a great idea.
That's a great idea.
And it also provides branding for the diapers, for the diaper
yeah,
bags.
That's right. Valerie?
Yeah, we have been using just like Sharpies to write the size and often the quantity on the bag. But we've thought about needing to do some labels or something because we don't have the branding. Like a lot of the agencies that we give to all the time, we'll find someone who volunteers for that agency. They've never heard of us, but they're giving out our diapers. And so kind of like we should probably do something about that.
Yeah, that's a good point. That's one reason for the value of labeling it. Maria?
Sorry. Can you hear me?
No problem.
It's Maria Lourdes. We've just been giving the boxes to the organizations, and they have their own way of just giving the 8 to 9 with their own little bags that have.
Okay, so you have the agencies are repackaging it for you.
Thank you.
Debbie, what do you guys do?
What we do is we use wastebasket liners because they're so inexpensive, and then we bought a stamp that has our logo, and it says, joyfully provided free of charge by the Memphis Community Diaper Bank.
Great.
That's a great idea.
That is a great idea. Pat.
have emailed Pat to let her know that we can't hear her.
Okay, so
she emails us back with her
all right.
comments.
Any other thoughts about repackaging? All right, here's a question that came up from some folks. Do you require agencies to do anything in return for the diapers aside from providing the tracking data that we all want? Such as, do you ask them to fundraise for you, to advertise the service to donors, to do diaper drives, to Kathy.
We actually, one of the things that we ask our partners to do is to be part of a speakers forum, because we work with a lot of volunteers in our Giving Factory in Brighton and also the one in Philadelphia. So in addition to our partners, working with us in other ways, we do ask them to come in from time to time to speak to volunteers about the work that they're doing. It helps them to talk about their mission. It also helps people to understand where these diapers are going and, the families that are going to be helped.
That's a great idea for raising awareness. Greg.
How about for
yeah, we
Greg?
have hello?
Yeah, go ahead.
We have a collaborative partnership agreement that's part of the initial agreement, and it's part of the renewal process that we ask for the agencies to choose from a selection of items to contribute back to us.
Right, and we got a copy of that partnership agreement, so we'll go ahead and send that out along with some of these other ideas.
Great.
Great. Whitney, please.
Hi, this is Whitney at Westside Baby, and we don't actually require providers to give us anything. We do encourage them to do diaper drives if they're able, and we do have a terms of use similar to what he was saying, to make sure that they're not selling diapers, making sure they're giving them to who they say they are.
Right. So standard terms of do what you say you're going to do with diapers. Okay, great. Any other? And Maria Lourdes.
Nothing else from me, thank you.
Okay. How about diapers at a discount? Anybody have really great sources for that? You're all listening to us, aren't you?
We're working on it, and I think that at this point, everybody has, their own way of doing it. We're working really hard with both Good 360 and Huggies and some other companies to try to come up with a buying program that'll work, but it is taking a little while.
While I have everyone on the phone, we're talking inventory. How many folks are having trouble figuring out a way to track the information? Or I guess how many folks are using Excel? Have a system that they like a lot for tracking information on who's getting what and how much is needed.
Allison, can you repeat that question one more time?
The question is, as far as inventory systems, how many folks have a system that they like a lot that they would be willing to share with the group? Hit a note somehow. Yeah. So what I was hoping to do. Unfortunately, Happy Bottoms folks can't join us, but they did offer to share an inventory tracking system that I will pull up on the screen and I'll send out to everyone as well. Might be very useful to folks. From it, for the folks on the screen, and ask you to take a look at these raising hands.
It's like petty. Only employee status changes.
Are you going?
Selena,
is working less well than I hoped it would. So what I'll do is I'll have you bottom folks send a cell-based spreadsheet that they use for tracking information such as the parents' last name, the children's names, birthdays, zip codes, gender, where the parent the child is living with, race, number of adults in the household, kids in the household, insurance, et cetera. It's a pretty comprehensive list, as well as sizes and quantities that you can use pretty easily to do pivot tables. But I think what we might want to do is hold that off for another discussion, because I think we're running out of time right now, and but I think, and we're learning a great deal about how to order these structured discussions. But I do want to thank everyone for participating.
And also, I will say one of the things about the Google Doc that we're going to send out is that the great thing about it is that you can do it month to month. That's what makes it different, I think, than what a lot of people do. Allison said, this is incredibly exciting that so many people joined us, and we really, really hope that it was useful, and we really would appreciate feedback. We know that it's not a perfect system. We're still working on the phone and everything. We feel like it's a lot better than it's been, but you know, please, any ideas you have or things that you'd like us to share if we don't get them out, or what it is that you'd like if we missed anything in the conversation once we send out the notes.
Thank you.
Thank you for doing this.
Thank you. Thank you guys very much.
Great.
Thank you. Thank you.
Thank you so much.
Thanks, guys.
Thank you.
Thank you.
Thank you. When you send the minutes, could you please send Happy Bottom's form that they use?
Hello?
Hello?
Yes.